Hello again and welcome to another episode of In Conversation. My name is Mpiletso Motumi and today I'll be sitting down with a panel to discuss neurodiversity. In studio today we have Prof Max, who is the director for our Center for Neurodiversity that is stationed at the Soweto campus. We also have Dr. Ameen and Dr. Waja, who will be telling us more about dentistry within neurodiversity. So I think maybe to just kickstart the conversation, Prof. Max, let's begin with you. Perhaps maybe for people that don't know what neurodiversity is or sort of have a little understanding of it, perhaps you can give us a short summary about the importance of knowing what neurodiversity is.
Okay. Thank you so much. Thank you for this space and also welcome to our guests.
Thank you.
And neurodiversity has to do with the wiring of the nerves, the neurons in our bodies, that we pick up information and process it differently. That makes us able to respond to the stimulus in different ways. That is the most basic one we can put, explain it. It is a new field that is, coming to us in the global south, but which we need to learn a lot. But this is why we have people who have been in the sphere for a long time to help us understand it more. I think we are at the space where we need to look at it scientifically, yes, but also bring it to a level where our ordinary people in the villages can also understand what is it that we are talking about.
Okay. All right. No, I like that.
Thank you.
I like that. Okay. And then Dr. Ameen, you are working together with Prof. Max within the space.
Yes, I am a research associate with Professor Sefotho. I'm also working for the Gauteng Department of Education in the Inclusion in Special Schools Directorate. And I want to add on with what Prof is saying, that neurodiverse is a concept. However, you have neurodevelopmental disorders, and that's where it affects the language, the communication, sensory issues, and so forth. We talk about ADHD, autism, and there's a range of neurodevelopmental disorders. And I think the conversation today is so critical because when you then move on to Dr. Waja, it's a space of dental that we have neglected or we haven't really zoomed into it. And I'm also a parent of a daughter who's on the spectrum. She has autism spectrum disorder, no speech, so she's nonverbal. And so even though I thought I knew a lot, it just shows that we neglect certain areas in our lives as parents. And I think this is so critical, this conversation today.
No, definitely. I mean, I wouldn't think teeth would have anything to do with neurodivergence. So I think, Dr. Waja, perhaps you can also then fill us in terms of when we're speaking about dentistry, what is the importance of dentistry altogether?
So the importance of dentistry is huge, right? In the space of each and every one of our lives.
Yes.
But even more so in the space of our differently abled people and our neurodivergent community and so on. Because in the way that they experience things and in the way they can communicate their experiences is very different. So to create a more sort of a comfortable and a more harmonious experience for them, I'm just so happy that these subjects are being addressed and further expanded on. And that will enable us all, as an entire team, to be able to treat this section of our community better.
So can you perhaps then tell us a little bit about how you sort of got into the field with children that are neurodiverse?
Okay. So it was quite a strange story, but in essence, I'm a dentist. I graduated as a dentist, but I've always had this thing. I think it's based on our history, our apartheid legacy, where in my personal space, we grew up pretty poor. And when we graduated as dentists, I knew from the onset that I wanted to give back to society. I was fortunate in a sense that my sisters were involved in these schools. So my sister was a teacher at Jiswa school. So during our holidays, we would go to the school and sit and play with these kids with clay and so on. So immediately I knew this was a section of the community that I would like to give something back to. And we started a little program, where we would do a bit of dental education with them. And that sort of developed into a more cohesive kind of a program. And eventually we created what's called the Waja Ka Meno Trust.
Yes.
And here we now give the whole scope of dental care, from the most basic education right down to advanced dental care to these differently abled people.
I love the play on words with the Waja Ka Meno. It's a basic statement, but it's such an important one to have. How did you sort of come up with that name?
Very intriguing story, I must tell you. So,
Yeah.
Waja Ka Meno means eat with teeth.
Yes.
Right? And my son is obviously Waja, and
Yes.
wherever I go, people say Waja, like this kind of thing. But as this program developed, right, and we've been doing this now for about 30 years, and we went sort of nameless for years and years, and along the line I won the lead essay award. There was recognition and awareness and that kind of stuff, but we never had an official title. But as time went on, people said, no, but you've got to have a name for your organization. And then I thought of this, I was speaking to my staff, say, let's get a nice African name and an African logo or something like that.
Yeah.
And then my staff said to me, but why don't you think of Waja Ka Meno? And I said, okay, Waja Ka Meno, eat with teeth sounded well, but I started speaking to my kids. I said, can you guys come up with anything smarter? And they were came up with a whole lot of things, never rang a bell. But the funny thing is, we're sitting at a UJ group of people, and I was actually at that point in time treating one of the academics from UJ.
Okay.
And while he's sitting on my chair, I said to him, listen, we've got this name Waja Ka Meno. Do you think it's appropriate? He said, why are you looking for anything else?
Yeah.
Just use this name Waja Ka Meno, and it just rings off so nicely off the lips. So,
Absolutely.
it's worked out very
Absolutely.
nice.
Sure. No, that's wonderful. Sure. And then when we're looking at sort of your work with children, how do you sort of manage the practical challenges when you work with children that have these sensory issues?
Yeah, so that is a proper challenge, right? I think the first thing is there has to be the awareness that they are special, that they need to be approached a little bit differently. But having said that, I really want to bring this message across so strongly, is that if you have a degree of awareness about them and you approach them non-judgmentally, what is truly the game changer to me is how they very, very quickly respond positively based on how you're responding to them.
Yes.
So when they come into my rooms, many times the mother would say, I've never seen him get on a chair like this. But it's only based on how we greet them, how we meet them, and they are just like one of us. And that really is the game changer. But obviously, in preparation for them, we would do, a fair amount of work behind the scenes. So if we know a particular group is coming in, we'd normally create a time on our appointment book to say that these kids will come in at this particular point in time. Then preparation starts from our reception area right down to the back. So the receptionist would know, okay, listen, this group of kids are coming. We'll have a welcome for them. So we welcome them with songs. We'll welcome them with balloons. We've got it. It's like on our Instagram pages. It's a huge hit for them because they're celebrities and that kind of thing. We obviously don't have all the other patients in the waiting room with all of the normal noise. We tone down the noise. We tone down the activity, all the irregular activities that would help, that would normally occur in a dental practice. Our admin staff in our environment, in our surgery would know, listen, manage the phone calls, the phone's ringing non-stop. There's proper preparation right down into our rooms. So our rooms on that day would be more contained. We would have the lights a little bit more controlled. We try and knock off peripheral sounds, our autoclave and this ringing and that ringing. So there is a degree of preparation. And that would include our dental assistants in it as well. And in that manner, we get them to play a role. But in this whole preparation, a key component is the community involvement. So what happens in those cases, we would always ask that someone that they're familiar with join them for their dental visit. So that could be the mother, it could be the father, it could be the auntie, whoever is giving care. Or it could just be the helper from the school, the teacher from the school. Those guys come with. And really, I share with people always, when we eventually treat a child, it really is not the dentist's victory. It is a victory of the dental assistant and the mother or the auntie, because they enable that to take place. The child sees me, they're naturally apprehensive a little bit, who am I? And basically, kids on the spectrum like familiarity. And now you bring them into a strange space. So many times when we bring them in, the first visit will be just about establishing this relationship. You know, we'd get them on a chair, we'd move the chair around, talk to them, have a look at their mouth, that kind of stuff. But it can be a truly scary space for them. We're aware of that. You know, we're bringing all of these foreign objects and looking into their mouth. So we try and make it as comfortable as possible, and, you know, slowly let them make the move across the space where they're more comfortable.
Okay, so would you say with a child, perhaps like Dr. Ameen's child, who's nonverbal, it would also sort of be the same process, but perhaps in terms of them being nonverbal, is there other cues that you would add to it, or how would that work?
So it's a very important question. So I think the key thing is to sort of treat them as a whole person.
Okay.
So each case is handled individually as that person presents. Right? So if it's someone that's like non-verbal, and funny enough, we do actually get the communication done. I must be honest with you. Yeah, we have several people that can't speak, but they've got their ways of getting the message across.
Okay.
So we adapt to that particular thing. So being flexible, being adaptable is a key component in this whole process.
All right.
Before you go on, can I add on?
Yes, please. Please.
I think what Dr. Waja has said, which is so critical, is the preparation. And in preparation, it comes from home or from the school.
Yes.
And I think that settles the child before the child even gets to Dr. Waja. And I think because they are children that like familiarity and they like routine, that preparation way in advance is important.
Okay.
Showing, like a nonverbal child, showing pictures of a dental surgery, showing pictures of maybe where they're going to go, because that prevents meltdowns eventually. Because can you imagine a child like my child going into a surgery where it's completely unfamiliar, sitting in a chair where she's never sat before, could create a different scene.
Yeah.
And that's where our children in places like Dr. Waja's have meltdowns. So I think that is a very, very important
preparation.
To get to that point.
So parents should also consider that and make sure that they prepare the children from home before they come to the visit.
Just to add on to it, one of those aspects of the familiarity is that we will normally say to them, bring with something that they are very comfortable with. So you say that toy or a teddy bear or a blanket or a jersey that they like to wear. We'll tell them, bring that with, and then they can settle in.
What age would you suggest that parents or caregivers start attending to their children?
Yeah. So generally, theoretically, all of us should start attending to our teeth from the moment at first tooth.
Yes.
That's at the age of 6 months, right? But I think more practically, myself, when I look at it, I would generally say to patients, if everything is fine with your teeth when you're 6 months old and 18 months old, then from the age of about 3, start bringing your child into the surgery. And even if at that point in time, we're not really doing any dentistry, it's just the fact that they start getting familiar with the space. And it really changes the game. Because eventually, what you don't want to do is to bring them in when they have a serious problem. You rather want, and this whole concept of us all being able to have good teeth from the onset till the end is really an achievable goal. So when you bring these kids in from 3, 4, you really find I've got tons of kids that have got no problems at all with their teeth. Because they're consistently coming in for the scaling and the polishing and the cleaning. There's always talk about diet, there's always talk about oral hygiene at home. And then that becomes a normal way of life. And then you can eliminate those problems.
Okay, sure. That's a very interesting point. Okay.
If you could allow me to perhaps ask Doctor, I think he touched on it a little bit earlier, the technicalities now when the children are in the surgery. We know from our perspective that in terms of the sensory reception of whatever is going on around them, might disturb. How do you normally deal with that?
Prof, now you're touching on something very, very important and really the crux of the matter. So we can have all of this talks and that, but the reality of the situation is we're now bringing these kids or adults into a space that's almost really like a war zone for them. Every aspect of our interaction is something that is not something that they truly are happy with or can relate to. So every aspect, from the sound that they're coming into, then we're starting to put things in the mouth and the taste, they are, they're very sensitive to different tastes, right? Even down to the toothpaste, if we touch a little bit later on how they can take care of their teeth, Then we're introducing all these things. We've got funny smells in the mouth. Then we've got all these things that we're suctioning water. We're spraying water. Now there's water spraying on their faces. We have a hard instrument, a drill, a bit, that we're pressing on their teeth. So it really is a challenging experience for them. And we've all obviously got to try our best to soften that space up as best we can. It's not easy, but we do get a lot of treatment done on the chair. They do deal with the challenge, and they are actually quite capable. They've got different strengths from ours.
Yes.
So we would normally talk about this neurodivergency, but with that comes strengths that they have that we don't have. Right? They've got creative components that we don't have. They've got problem-solving capacities that we don't have. So they do find a space where they actually manage to go through that process. But if I might add, Prof, what happens is if we cannot treat them on the chair, then we've got alternatives to that.
Okay, all right.
So sometimes we have this, we always have these options. And I think one of the things that makes the treatment really sort of good is when you actually can provide options. When the parents knows there's options and when that person knows there's options. So the one option being, okay, we're going to treat you on the chair, you're going to go through this, but you're going to come 5 times, you're going to come 6 times. I do have to give you an injection. I do have to drill, right, that part. The other option is something that we call conscious sedation. This is the in-trending thing at the moment. So what happens with conscious sedation, a anesthetist, not myself, an anesthetist, a doctor, will come to the practice. He virtually sets up like a mini theater in our room. There's huge peripheral preparation. But he sets up like a mini theater, and him and his team then conduct this process called conscious sedation. So what happens there, the person is basically sleepy. Right? They're not aware of what's going on. But it's not a fully fledged general anesthesia. But you can drill and you can fill. And such is the effects of the medication that they don't even remember the procedure. So really when they've woken up and they've gone home, they don't even know that they've had this procedure. Right? So in that particular situation, what happens there is we will do all of their treatment in one go. Teeth that have to be extracted, we'll extract. Teeth that have to be cleaned, we'll clean. Teeth that have to be filled, we'll fill. So there's a proper treatment plan drawn up ahead of time so that when we go in on that day, we get things done. So that's conscious sedation. The other aspect that we have is the other treatment modality that we have is called general anesthesia. So that is now the real McCoy. What happens there is we take the person into theater. Anesthetist is there as well in a fully fledged theater. We'd make the child sleep. The anesthetist will make the child sleep. We'd go in again and do all of the treatment in that time. I'll tell you 1-2 things at a different time because we won't have time, but with the Waja Ka Meno Trust, we have seen real live miracles when we've taken these when we've taken these kids to theater, right? So it's really a remarkable environment. I always tell the dentists, please get involved because you will see things change in your life that you cannot believe. So those are the 3 different ways that we could treat it.
All right.
Can I
Yes, please.
You obviously have a anesthetist that's very much in line with how you do things because I think that is also critical. So your team, like you mentioned, is very aware they have the education on the type of child that's coming in and that because I think that's so important.
Critical.
Another thing that I also picked up from you is that when we look at our children, we actually have to look at them as human beings that have feelings, they get hurt, they experience pain. We assume a lot. So the assumption of, you said, once the treatment is done, how would we, obviously there'll be signs and symptoms that they're not experiencing further pain. How do we manage that part? Because a child that is non-verbal, because you have adults going to a dentist and coming back and saying, oh my word, my tooth is so sore. With a non-verbal child that's on neurodiverse, how do you manage that, or how do you ensure the parents are comfortable enough to know that everything is all good?
Right. Nausheen, may I just take a step a little bit further back? So what happens is, even prior to any dental treatment, it is such a challenging situation for parents, for caregivers, for teachers to actually know if their child is experiencing dental pain or not, and then even before treatment. So they cannot communicate to you that they're necessarily feeling pain, right? They cannot necessarily in a particular way make you understand that they are not comfortable
Yes.
eating.
Yes.
So you've got to pick up all these different little cues. So what happens sometimes, parents will say, you know, all of a sudden he's drooling a lot from his mouth. All of a sudden he's not sleeping well. This is, I'm just mentioning day-to-day experience. Then you have the more aggressive situations where the child will start biting his lip. Then I've seen a child myself where the child bit the child's hand blue from here, top to bottom. So in trying to deal with this discomfort that he's feeling, or she was feeling, she was biting her hand blue. I got a shock. I thought somebody beating up the child. Right? Then you have the more extreme cases where the child will knock his head against the wall, causing further injury. So under those circumstances, the parents will bring them in, and then dentistry or the pain in the mouth would be one of the options. And we normally take a multidisciplinary approach. So even before we take a child into theatre, we would tell the mother, right, please take the child to your doctor, let them have a look. There's two aspects. Let the doctor see that the ears are fine, the eyes are fine, but also let the doctor decide whether this child is healthy enough to undergo a theatre procedure. Right? Then when we go into theatre, we will then do the dental care. Now, after the procedure, that's where your question is, now it becomes even a little bit more subtle, right? In terms of how they're going to pass that information across. Now, we would really be, when we go in with these kids, we try and be as thorough as possible. So we try and eliminate leaving gray areas, you know, around that area. When we go in, and everyone relates to the situation. You know, they understand it's not a case where we can take someone into theatre, out of theatre, into theatre. So when we go in there, we try and be as thorough as possible. And with the grace of God, we don't have too much drama.
That is such an important aspect. The whole issue of when children are displaying that type of behavior, because a lot of parents and teachers say, these children are just naughty. But the comorbidities of some of these conditions are critical. And now we're listening to the dental care of that could also display some of this behavior. And many parents will just say, you're just misbehaving, or we don't know what's going on. They're throwing tantrums unnecessary. But it's now another important aspect to look for when your child is going through all that.
There's also one more thing I might just add, talking about comorbidities and so on, is that when we're going into theatre or under general anesthesia, many of these kids are under medication. So the fact that they're on medication, certain medications, we have to pass it on to, we need to know it, but the anesthetist really needs to know it, because there can be reactions. Right? For example, with the anesthesia that we give them, cross-reaction with the medication that they take. So there's going to be proper consideration given to those kind of things.
Sure. So for parents that perhaps have a neurodivergent child and they haven't considered oral hygiene, what sort of challenges could they be faced with? Because I can assume that there's obviously many things that happen inside the teeth. So what sort of issues would they face if they don't actually have a dental?
Excellent question, right? I'm also quickly going to just jump on that point of, we say, the parents and the oral hygiene. One must also always keep in mind that this is the dental component in this particular child's life is huge on the parents, because this is now one additional aspect that they have to deal with. And sometimes we actually just see that to some parents, it's just too much. Right? So even though we're available to give the dental care, but the complications that come with giving the dental care makes the parent decide, not now, please. Maybe later on, but not now. Right? So that's a separate thing. Now, when it comes to what is going to what dental problems they would experience, it's a range of items. But the most obvious ones, and they're all important, is aspects like gingivitis, which we all get, which is gum infection. Right? So the gum infection will be there. Coupled with the gum infection, they can even have things like gingival hypertrophy. Now, this is overgrowth of the gums, and this is normally associated with the medication that they're on and that kind of stuff. Right? This gingivitis can then progress, whereby it starts not only eating up the gums, but eating up the underlying bone. So our tooth stands like this. It's held by bone, and we've got a gum over the bone. So as the gum disappears and as the bone disappears, these teeth all become compromised. So you then start getting a looseness, mobility of the teeth. But even prior to that, as the bone goes down, it's much easier for food to get caught in between the teeth, and you start creating this vicious cycle. So that almost 100%, you know, when we have a special needs kid coming in, we can expect those kind of stuff. It then goes further, obviously, with all of these things in place, the teeth get cavities, like really like bad cavities, so they would have to be treated, either filled or they'd have to be extracted. Then you get peripheral things like delayed eruption, the teeth don't come out at the right point in time. Then you have elements like orthodontic issues, where the teeth are not positioned correctly. We have differences in the size of the upper jaw, the lower jaw. Then you have things like bruxism. This is a big thing these days, even amongst the general population. So the general population now are going into this bruxing element where we grind our teeth. And this is a subconscious activity. So you're not deciding to grind your teeth, but because of our stress levels and because of our 24-hour connectivity, we end up grinding our teeth. Now that is hugely destructive. Now these kids also, with the challenges that they face, they have this subconscious activity where they grind their teeth a lot. So they wear these teeth away. And that results in temporomandibular joint issues, and a whole range of things that can happen, you know. So that's what the parents can expect can go wrong with the teeth. Right?
Absolutely, yeah.
So to sort of prevent that, we always talk about the care that the parents have to give.
Yes.
And when we look at what are the aims that we would have as a dental practice that participates in the treatment of these kids, you know, we would look at as holistic care, that patient-centered care for the person. But the other thing is also this independency that we try and create in these kids. And that's where the kids come in, where the parents come in and the kids come in, where they have to independently play a role in taking care of their teeth.
Beautiful.
Right? So there we would talk about the aspects of brushing twice a day. Now, if I talk to you guys, say like, listen guys, brush twice a day, floss, use a mouthwash, see your dentist every 6 months.
Yes.
But with them, it's a whole different ballgame.
Sure.
Because all of these components that I'm mentioning can be quite a challenge. Like, for example, them taking the toothbrush, right? So first of all, you have the manual dexterity issue, right? The ability to manually handle the toothbrush, put the toothpaste on, right? Put it into the mouth. Have the right technique. You will have the right technique when you're brushing your teeth. So for them to do all of that is a challenge. Then you have the aspect of the texture of the toothpaste on the tongue, which they don't necessarily enjoy. Then you have the aspect of the bristles of the brush going around. Now, we would these days talk about using soft bristle brushes, and there has been huge enhancements in the quality of the bristles of the brushes. So those things all have to come to the fore. But then you have other aspects like just the attention span. Are they going to keep their attention because they're going to get distracted with this, distracted with that? So then the mothers, caregivers have to play a role in keeping that attention going for that 3 minutes. And 3 minutes is a long time. But 2 minutes is a long time. It's a long time. You know, for anybody, right? It's a long time. I tell people always, you know how long 3 minutes are.
Especially with the toddlers and oh my goodness.
You know, I tell people, you want to know how long 3 minutes are? Run on the treadmill. You'll see how long 3 minutes take. Or hold an impression in someone's mouth for 3 minutes and you know how long 3 minutes are. So then the parents have to make a song, you know, play a game, keep them interested, and in all of that kind of thing, make sure the teeth get brushed, make sure the teeth get flossed, all of those kind of stuff.
Sure.
You know, within our curriculum, the school curriculum, we have the differentiated CAPS curriculum for our severely intellectually disabled children. And I'm just thinking that our main aim within that curriculum is to provide independence. But independence to a lot of us is to be able to dress yourself, to maybe wash your hands or maybe wash your face, the basic things. But I think that this is an aspect that if you start teaching even a child that's severely intellectually disabled how to at least put the brush in the mouth and be able to do something, says a lot.
It goes a long way.
It goes a long way. So you are bringing something to my attention when it comes to the teaching at schools and what we start discussing with them in terms of independence of a child, because this is for me it's absolutely critical, because you've mentioned so many things that if you don't take proper care of your mouth can lead to other things. So we look at the most basic things, but we're forgetting oral hygiene, which is so critical. So I'm very excited to go back into the schools and say, oh, are you busy with this? Even if it's a small little part, but you need to start this.
The process,
and let's start the conversation going.
Take this moment to make the story a little bit more scary.
Oh, wow.
So what happens is that our mouth has got a direct impact on our general health. I'll just
Yes.
touch on 2-3 points. So number one is if we have a gingivitis, every one of us, it creates a septicemia in our blood system, and it makes us all more prone to heart infections, right? Every one of us. Now, if you have a child that might already have underlying heart conditions, and now you have this influence on top of that. Coupled with that, it makes you more prone to developing things like sugar diabetes, right? It makes you more prone to develop things like Alzheimer's disease. If you're a pregnant person, it will impact on the date of delivery. People always say, what are you talking about? The date of delivery, the weight of your baby. That's the impact of your oral health status.
Yeah.
So now that's superimposed on these kids' general life. You can see how important oral care is in their space.
Sure.
Yes,
My
an area
goodness.
that really, I think from my perspective, I just neglected.
Yes, completely. Sure. And I mean, if perhaps you have parents who won't necessarily be able to get to Dr. Waja and they just go to their regular dentist, what sort of conversations should they be having with their dentist specifically about their children? Yeah.
And it's an area that's virtually sort of coming to the fore around the world, sort of almost exploding around the world. So it is that awareness that a dentist has to have, right? And these are generally, there will be this, and in fact, this was at Thabo Vuyo School where one of the speakers mentioned it, is that you'll get a shock how people are really prepared to give that extra little bit once you make them aware of the special needs of that person. Whether it be going to the dentist, whether it be going to the restaurant, whether it be going anywhere else, you tell them, listen, this is my needs, please, if you could do that. So most of the dentists will certainly try and adapt. But there's various components to the whole issue. So firstly, dentists as a professional are generally will be seen as introverted kind of people, non-confrontational kind of people. That's the box that dentists
Yes.
Like a banker will be packed in the guy with a grey suit and the analyst. Dentists are also packaged in certain ways. It's changing because we're seeing a lot of creative dentists coming to the fore, and you're seeing the whole variety of things coming. But nonetheless, if they tell the dentist would then try and do their stuff. There are certain dentists that would just say, listen, I can't handle this, so please take it somewhere else, that kind of stuff. But you also find that these people will come into a very challenging environment already. So being a dentist today is a very challenging environment. It's a stressed environment for the dentist and his staff and that kind of stuff. It's one where many of them are really battling to make a living. It's that kind of stuff. Superimposing it, you got the NHI coming and you got all of these things coming. And now within that challenging environment, you have the one person coming in. And I mean, I have this challenge a lot. So say, for example, a mother comes in now. So I've become the dentist. But when the mother comes in with this child, the mother will say, when this child was born, the sky was green and it was raining. And then when I gave him the first nappy, he didn't like this nappy. Now you got to sit there, and that's what the mother wants to do.
Yeah.
She wants to tell you the whole story from when the child was born, and you're sitting there, you've got 4 other patients waiting, and that kind of a situation. So it really is a challenging space. But nonetheless, share it with the dentist. And these are the spaces where they'll maybe prepare a special time for that kid to come in, either early in the morning or in the afternoon, or some special arrangement they'll make.
Okay, all right.
Dr. Waja, you're mentioning a lot about mothers. Can you talk about the fathers?
I'm not so sure you guys want to hear the story about the fathers. So we're sitting with 2 ladies here, Prof, and I'll share with them my experience with fathers.
Yes.
So there is a very, very distinct change, one that we've seen not only now, but we've seen it for a while. And that is the more prominent and almost dominant role that fathers play in the life of these kids.
Beautiful.
No word of lie. So we see it consistently. Say, for example, either when the child comes for their first visit to the surgery, the fathers are more prevalent. You will see more fathers bringing the kids. I must tell you, the fathers have got it together these days. When they sit in, they are smart. They are articulate, right? They're not emotional. They are articulate. They tell you clearly. I mean, there's a father coming to mind just now that we've seen. So you see a lot of fathers coming in. Certainly when we go into theater, now this is a extremely stressful environment. I mean, things can really go wrong in theater. And you come to the hospital and there's just machines going off, and there's
Yes.
people being wheeled in on trolleys and wheeled out, and there's blood and all that kind of stuff. So it's not an easy environment. And then when we eventually take the children in, it is mainly the fathers that accompany the kids into theatre. The mothers, I'll tell you guys this, you guys are not going to like me a lot. The mothers are sitting wobbly in the one corner.
We're too emotional.
They're shaking in the other corner. And the fathers are standing strong and tall. Which is great because you now really have this team around the kid, right? Because the mother brings her own value, but the father's also there. You know, we're always worried about the absent father and the effect of the absent father and that kind of stuff. But with many of these kids, you see families.
Yes.
You know,
Sure.
Last month we launched fathers of children with neurodiversity group. We want to call it a forum. I think the word forum is thrown around, but this is a very special one. And I'm sure when they listen to these stories, they would want to hear more. So if you come knocking on your door, doctor, please open that door. Because I think it's not only an exercise in itself, but it is encouragement. It is also the strengthening of the father figure in the home too. What you are saying is very important.
Yes.
And I'm sure many of them would, want to hear more of these types of experiences because of the role that as fathers we have to play in support of the mothers. Yes, they may be sitting at the corner, maybe not feeling that strong at that particular time, but I want to think that their strength far more surpasses what we can think of. And together, as a team, as that family,
Prof,
we
I might just
know
add
that.
on to the road that you're taking in the creating of this group or this forum is so powerful, especially in the South African context. So when we look at our culture and our historical behavior, culturally, right? This role of the father within that space as the bread giver, now the caregiver, now the church leader, all of those components sort of brought into that space. I think it's a huge thing.
No, absolutely, sure.
And the removal of the stigma
Yes.
attached to families,
Yes.
and specifically as the father was supposed to be the breadwinner, and I as a son that's neurodiverse, and how do we then navigate through a community, a society that doesn't have that education and that advocacy. Great.
One more thing that I think I picked up from what you were saying is linking to what my sister was saying earlier. The type of softer brushes that need to go in, be used in families. And I'm just thinking, as I said from the beginning, in the communities, how do people access those? How is awareness created such that they go out, they discard the harsh brushes that might actually aggravate the problems of oral health?
I think because also, that people would associate it with being expensive. If you feel like you need to have a specific type of brush, it's more expensive.
Yes, of course.
So 2-3 steps. So number one is part of the challenge we have from neurodivergent kids is the fact that they do actually damage their gums with aggressive brushing, right? So that creates what we call a toothbrush abrasion. Even us as general public, we feel we only cleaned our teeth when we've brushed hard. It's the story we give people that you don't have to brush hard, plump is soft. So you've got to use a soft brush or toothbrush so you don't cause a damage. But that's one thing. But the access to those toothbrushes and that, you're right, is a huge challenge. That's a huge challenge. The knowledge and information is a huge challenge because people don't know about it. There's actually a whole range of different kind of toothbrushes that are specifically geared to the differently abled community. So there's toothbrushes that can cover a tooth like in the almost like a 360-degree kind of way. There's toothbrushes that can brush the top teeth and the bottom teeth in one go. Right? Then we've got various added things that we can use these days, like things called aqua floss, water floss, so that you can spray the water on their teeth, and that starts making things a bit easier. But one of the aims and ambitions of the Waja Ka Meno Trust is to drive a program. We've started this program, and that is to empower all of our kids with these toothbrushes. So in other words, we will run a program. We just got to, and this is where we can play a role with guys like yourself. where we've been speaking about these, we just lose mamas and papas and what have you, that are from the communities. So if we, and we're not talking about here Deep Kloof and here Deep Sloot on our doorsteps, we are talking about the rural areas.
Yes, absolutely.
Where we want to hit those areas, and the Waja Ka Meno Trust must have a program where we go out and we will have support, and we go out and we make those toothbrushes, the toothpaste, those things accessible to these guys.
Okay,
You know, so that's part of our aim.
I think that's beautiful.
Absolutely,
Because
sure.
that's where the need really
That's
is.
where the need really is.
Absolutely, yeah. I mean, and it's something that you never really think about, how important your teeth is for your verbal, your just eating everything,
So
basically.
look, your teeth today is insanely positioned. If you had to look at it as a product, as us as dentists, so I have a lot of young dentists come in shadow. So if you take Saturday, I had 3 young dentists shadowing, like in our studio with 3 young dentists shadowing. But I highlight to them, they are so strategically positioned because they're at that perfect frontier between looks, that's aesthetics, and health.
Exactly.
It's the perfect frontier. So we're all worried about how good looking we are, and we're all worried about our health. Right? So it's that frontier where the one leans on the other one. So even for these kids, right? I mean, when they come, they are worried about how they're looking. And we play a role in, trying to improve their condition.
All right, sure. That was a really insightful conversation. Perhaps maybe we can just leave with the final thoughts from our entire panel, just broadly on oral hygiene and its importance.
Super important. Firstly, thank you for having me. The oral hygiene part is super important, so focus on it.
Yes.
You got to give it that 2 to 3 minutes in the morning. You got to have brushing twice a day. You got to floss. And now we go sick mentioning this word floss, because for 20 years we'll see a person and each time we tell them to floss and they look puzzled, right? But flossing takes care of 25% of plaque in your mouth. When they ask cardiologists what are the 3 most important things that we need to do to prevent a heart problem, they will mention flossing. So that's how important flossing is.
Yeah.
And then obviously your mouthwashes, and then go see your dentist every 6 months. It is genuinely the game changer. And it's just appreciate your teeth and the role that your dentist plays.
Sure.
Thank you.
Thank you so very much. Dr.
I definitely am going to promote oral hygiene with parents. I do a lot of parental support.
Yes.
And definitely going to speak. That's going to be part of my presentation because I think it's so key. The next thing, I'm definitely going to make an appointment with Dr. Waja for my own child, which I've neglected. But absolutely informal, beautiful presentation. Really appreciate
Thank you.
it, Dr. Waja.
Wonderful.
Thank you so much.
Yes.
For me, it is really a great learning curve, but I feel like from the education perspective, we still have a lot to do.
For sure.
The last question I asked of brushes and all that, why can't we have this men's forum be the ones who actually produce this and go ahead and teach the communities about this, because this is a great lesson that we should be taking on to say, what is it that we are doing?
Yes.
I'm feeling very happy that we are creating this space. The collaboration between the Center for Neurodiversity at UJ with the presence of Gauteng Department of Education through her presence is really helping us to understand. As I said in the beginning, there's a lot that we still yet to learn. And the proof is in the pudding. We've just seen what has happened here. And thank you to UJTV for giving us a home to be able to talk about this, but also to disseminate the information out there,
which is so important. I think there's so many people that don't know about this, and this was such an informative session. I'm going to go home now to my little TO and be like, how am I going to switch your teeth out?
Thank you so
So
much.
no, thank you so much. Thank you for joining us. And that basically wraps up our In conversation today. I hope you guys have learned just as much as I have about the importance of dental care and oral hygiene. Until next time.